To 4 minutes.
Thank you very much, Presiding Officer. At the outset, I want to remind the Chamber that I am a board member of Moving On Inverclyde, a local addiction service. Like others, I want to add my condolences to the families of people who have lost their lives due to drugs. Every life lost to drugs is a tragedy and one that we as a society do need to address. Turning substance abuse from a justice to a health priority is imperative, and the direction of travel in that regard is positive. And it's absolutely vital that treatment and recovery that is right for individuals is available at the right time. This is a crucial key factor of the National Mission. It's also worth reminding the Chamber of the SNP manifesto from last year's parliamentary election, which committed the SNP-led government to develop a new national community justice strategy. As the government motion states, and I quote, determines that access to high-quality drug treatment, rehabilitation and recovery services at appropriate points in the justice system. No one in this chamber can actually argue against that, and the work that takes place in our prison estate to help prisoners with addictions is something that we should all be supporting. Now, can we do more? Absolutely we can do more. We can always do more in every single aspect of our lives. However, it's vital that we ensure that the cycle of re-offending is broken to help rebuild lives. The reinforcement commitment to continue to improve support for people leaving prison is also something that every single one of us can support. And one of the key ways of helping deal with this is in tackling stigma. And I've spoken to various people over the years about people whose lives have been blighted by addictions. And the issue of stigma is a constant. And if this Parliament genuinely believes that dealing with the drugs death situation that Scotland has, then we really got some genuine and hard questions to put to ourselves, but also to society. Annie Wells touched upon earlier on regarding the issue of reintegration into society. And certainly I agree with Annie Wells on that particular point, but I think that the issue of stigma, dealing with stigma, is also crucial to help with that reintegration. The National Mission, led by the Drugs Policy Minister Angela Constance, is clearly leaving no stone unturned, and working with people with lived experiences is absolutely essential. Now, I welcome the creation of the National Collaborative, chaired by Professor Alan Miller, and his commitment to ensure that the views of people with lived and living experiences are reflected. The fact that bringing people together who have been affected by drugs to make recommendations to the Scottish Government about changes to services can only help improve and also save lives. As part of the new Vision for Justice policy announced last month, the Scottish Government's ambition, shared with COSLA and many other partners, is for a trauma-informed and trauma-responsive workforce across Scotland to address inequalities and improve life chances, ensuring that services and care are delivered in ways that, first of all, are informed by people with lived experience. It also recognises the importance of well-being in the workforce, recognises where people are affected by trauma and adversity. It responds in ways that prevents further harm and supports recovery, and also can address inequalities and improve life chances. Embedding trauma-informed practice will ensure that Scotland's justice services recognise the prevalence of trauma and adversity, realise where people are affected by trauma, and also respond in ways that reduce re-traumatisation. And Presiding Officer, finally, today and previously, we've heard from some members about their opposition to the new approach adopted by the Lord Advocate with regards to the diversion from prosecution. In Scotland, prosecutors are provided with a range of alternatives to prosecution, including diversion from prosecution, to respond appropriately to the facts and circumstances of each specific case. It's obvious that there is no one-size-fits-all, and certainly there is a long journey ahead. However, I believe that we are now moving in the right direction, but I do also want to highlight that there's a long, long journey ahead.
Thank you, Mr McMillan.